Welcome. Have you ever experienced a nagging, aching pain deep in your buttocks or rectum, seemingly without a clear cause? It might be something called Levator syndrome. In this video, we'll explore what this condition is, its potential causes, how it's diagnosed, and what can be done to manage it. The exact cause of Levator syndrome, sometimes referred to as chronic pelvic pain, remains somewhat of a mystery. It's considered a functional disorder, meaning there's no readily identifiable structural abnormality. However, several factors are thought to contribute. These include chronic tension in the Levator muscles, the group of muscles that support the pelvic floor. This tension can be caused by childbirth, straining during bowel movements, psychological stress, past pelvic trauma, or even surgery. Some researchers also believe that nerve irritation or inflammation within the pelvic region can play a role. The pathophysiology of Levator syndrome centers around the hypertonicity, or increased tension, of the Levator muscles. This chronic muscle tension leads to pain and discomfort. The heightened muscle activity can also compress nerves and blood vessels in the pelvic region, contributing to further pain and dysfunction. Over time, this chronic pain can lead to sensitization of the nervous system, making individuals more sensitive to pain signals in the pelvic area, even with minimal stimulation. It's difficult to pinpoint the exact prevalence of Levator syndrome in the general population, as many individuals may be undiagnosed or misdiagnosed. Studies suggest it's more common in women than in men, particularly those between the ages of 30 and 70. However, it can occur in individuals of any age and gender. It is also thought that it often goes unreported due to feelings of embarrassment or discomfort associated with discussing pelvic pain. The hallmark symptom of Levator syndrome is a persistent, dull ache or pressure in the rectum, buttocks, or perineum, the area between the anus and the genitals. The pain is often described as a throbbing, aching, or squeezing sensation. It can be triggered or worsened by sitting for long periods, stress, or bowel movements. Some individuals may also experience pain during or after intercourse, as well as urinary frequency or urgency. Importantly, the pain usually isn't associated with bleeding or fever. Diagnosing Levator syndrome can be challenging, as there are no specific diagnostic tests. Diagnosis relies heavily on a thorough medical history and physical examination. During the examination, a doctor will palpate, or feel, the Levator muscles through the rectum or vagina to assess for tenderness and increased muscle tone. To rule out other potential causes of pelvic pain, such as infections, inflammatory conditions, or structural abnormalities, the doctor might order blood tests, imaging studies like MRI, or a colonoscopy. While Levator syndrome isn't typically classified into specific subtypes, its presentation can vary depending on the individual. Some people might primarily experience rectal pain, while others may have more prominent buttock or perineal pain. The severity of symptoms can also range from mild discomfort to debilitating pain that significantly impacts daily life. It's crucial to recognize that each case is unique, and treatment approaches should be tailored accordingly. Managing Levator syndrome usually involves a multi-faceted approach aimed at reducing pain, relaxing the pelvic floor muscles, and improving overall function. Physical therapy is often a cornerstone of treatment, focusing on pelvic muscle relaxation techniques, biofeedback, and exercises to improve posture and core strength. Pain medications, such as muscle relaxants or analgesics, may be prescribed to help alleviate symptoms. In some cases, nerve blocks or trigger point injections can provide temporary pain relief. Psychological therapies, such as cognitive behavioral therapy or stress management techniques, can also be helpful in addressing the psychological factors that may contribute to the condition. Lifestyle modifications, like avoiding prolonged sitting, practicing good bowel habits, and managing stress, can also play a significant role. As the causes of Levator syndrome are not fully understood, there are no definitive prevention strategies. However, certain lifestyle choices can potentially reduce the risk. Maintaining good posture, practicing proper lifting techniques, and avoiding straining during bowel movements can help minimize stress on the pelvic floor muscles. Regular exercise, particularly exercises that strengthen the core and pelvic floor, can also promote pelvic health. Additionally, managing stress and addressing any underlying psychological factors can contribute to overall well-being and potentially reduce the risk of developing chronic pelvic pain. The prognosis for Levator syndrome varies. While there's no cure, many individuals experience significant improvement in their symptoms with appropriate treatment and management. It's essential to be patient and persistent with treatment, as it may take time to find the most effective combination of therapies. Recent research has focused on exploring the role of nerve sensitization in chronic pelvic pain and developing more targeted therapies, such as neuromodulation techniques, to address this issue. Additionally, researchers are investigating the effectiveness of various physical therapy interventions and psychological therapies in managing Levator syndrome. As our understanding of this condition evolves, hopefully, even more effective treatments will emerge.